Hello everyone, welcome to another AMA Steps Forward Innovation Academy webinar presented by the AMA's BHI Collaborative. The Collaborative is a collective product of 12 of the nation's leading physician organizations dedicated to equipping physicians and their practices with the necessary knowledge to sustain a whole person, integrated approach to physical, mental, and behavioral health care. Today's topic is working with employers to enable behavioral health integration. And over the next 30 minutes, we will discuss how employers are leading efforts to ensure timely, equitable access to whole person care for their employees and their families. By the end of today's discussion, you will have a better understanding of employer efforts underway to support a holistic approach to patient care, their priorities to address their employees' mental and behavioral health conditions, and key opportunities for how physicians can work with employers to make whole person care a reality. Before we get started, please note this webinar is for informational purposes only and is believed to be current and accurate at the time of this posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the AMA. Here to present today is Dr. Raymond Tsai. He is a family physician by training and AMA member who is serving as the Vice President of Advanced Primary Care for Purchaser Business Group on Health, or PBGH, a nonprofit coalition of around 40 private employers and public entities nationally that collectively spend $350 billion annually purchasing healthcare services for more than 21 million Americans and their families. He is currently working with PBGH to help their employer and purchaser members identify high-quality advanced primary care that meet purchaser standards, which includes integrated behavioral health as a core component. And with that, I will turn the discussion over to you, Dr. Tsai.
Thank you so much for that introduction, and thank you for having me. It's actually really, really exciting to be able to talk with AMA physicians about this topic. Whenever I'm at AMA meetings, I find there's actually not a lot of information or a lot of understanding of how employers fit into the healthcare landscape. And I actually find that to be a shame because in my personal experience, employers actually can be a great ally for clinicians because we all want the same things. And I'll talk about that a little bit before we get started. But in general, when you think about it, employers are purchasing benefits on behalf of their employees and their families. And ultimately, they want it to be exactly that, a benefit. And unfortunately, as we all know, there's been a lot of frustration with healthcare in terms of increasing costs without improved health outcomes, as we've seen in our life expectancy in the US. And there's also a lot of frustration on the patient and clinician experience side of things that doesn't feel great when you're trying to provide a benefit. And so overall, employers are really there to advocate for the best patient experience and the best health outcomes that they can for what they're spending. And that's exactly what we want as clinicians. And so I think there's a real opportunity here to work together on things like behavioral health integration that really moves the needle forward on that. And so thanks so much for the introduction of Purchaser Business Group on Health as well. And just to kind of go over it in a little bit more, on the next slide, we have overall, many of the things that you've mentioned in terms of our membership composition. We're a nonprofit membership organization, and we have come together as private employers and public purchasers to really do three things: advancing quality, driving affordability, and fostering health equity. And on the next slide, we have a sample of some of our members that are participating in this effort so that we can work together to improve the healthcare system. Now, just so you know what we do overall, in order to achieve those goals, on the next slide, we have what our moonshots are. One is redirecting existing healthcare spend to high quality, equitable, and evidence-based care. The other is redirecting purchasing to support whole person health, just like we're going to talk about today. And then the last one is eliminating disparities in the healthcare delivery system. And as someone who lives in rural parts of California, this is something that's near and dear to my heart as well, given the divide between urban and rural populations in terms of healthcare access. So in order to achieve this, we actually have 5 strategic priorities that are listed out on the next slide. And what they are is, one, advanced primary care. And this is what we'll talk about in a little bit more detail later in terms of how employers are really leaning into holistic healthcare. We're also really focused on addressing low value care, maternal health equity, community health and well-being, and mental health. Now, even though these 5 things are listed as separate strategic priorities, in reality, they're all connected, right? And so we'll talk about advanced primary care, like I said earlier, but when you look at the value that mental health can bring in terms of healthcare spending and doing it correctly, that also addresses our second strategic priority. We all know that maternal health equity, one of the areas where we're seeing lack of equity is in mental health, so it's embedded in there. And with community health and well-being, I think we're all kind of aligned on the mental health crisis that we're facing as a nation, and so it's embedded in there as well. And so even though they're kind of 5 different strategic priorities, they're all interrelated in one way or another. Now, like I said, I want to talk specifically about advanced primary care, but before I get there, I know a lot of physicians probably still don't really quite understand how employers fit into the healthcare landscape. And so I want to do just a really, really quick primer just to get everybody on the same page. And there's probably 4 things that I want to talk about, and I'll start with the next slide. But those 4 things is the general structure of employer-based insurance, some of the regulations, how employers talk about healthcare, and then lastly, what the mental health landscape is for employers. And I think that will provide an overall good primer. Starting with the overall structure of employer-based insurance. So employers and purchasers are actually a huge part of our healthcare system. About half of Americans will receive health coverage from employers. And you'll see that in this graph, I've actually divided it up into self-insured and fully insured plans in the 2 shades of blue. And the reason for that is because these 2 things are actually very different, and how employers interact in the healthcare system will be different based off of which bucket they're in. About 2/3 of them are of the half are in the self-insured bucket, and then about 1/3 is in the fully insured. Now, what the difference between those are, in very broad brushstrokes on the next slide, is really where the risk is held. And so for self-insured, the employers are holding the risk, meaning they're paying all the claims, they're regulated federally through ERISA, and then because of that, they also have more control over the health benefits. In contrast, you have fully insured, where the risk is being held by the health insurance company. And so the employers are actually paying a monthly premium, and the health insurance companies are regulated by state and federal laws. And the employer has actually less control because it's kind of, you buy it as a package in terms of what you're getting. And so how employers interact with their benefits will actually differ in these 2 buckets. Now, when you're working with employers as well, the other thing to think about too is they're actually under immense pressure, which from lots of different directions. And so if you go to the next slide, this is some of the things that are on the mind of employers nowadays. Obviously, affordability is on the mind of everyone, from government to employers to patients and families. But in addition, there are some federal regulations that employers are having to deal with and comply with. One is the Consolidated Appropriations Act of 2021, which placed more fiduciary risk on employers. So employers were always fiduciaries of the health plan and health benefit dollars, but this puts more risk in terms of being able to get Well, to be honest, to get sued about it if they're not really showing that they're good fiduciaries of spend. The other thing, as it relates to behavioral health, is the Mental Health Parity and Addiction Equity Act. That got updated in September 2024 to be sure that there's parity in coverage between mental health and substance use disorder benefits as well as medical benefits. And so these are things that are on the mind of employers. And so when you're working with employers, just realize there's some of these pressures that are also existing, and also ways that you can relate to employers when working with them. The next thing I want to go over is how to shift your discussion or things that employers find as important when you're talking to them about different issues. So if you go to the next slide, this kind of goes over the mental health crisis, but I will say that this is going over it in a very medical model. These are things that we all talk about all the time, right? In terms of the medical health need, how it's in primary care, so that's why we should integrate it in primary care, and how much money it's costing the system overall when when you're not integrating behavioral health. But if you go to the next slide, employers will actually think about this a little bit differently. And so it is important to shift your language when you're trying to talk to employers about this issue. We're thinking more about ROI. There's been studies that show that for every dollar invested into behavioral health, you get $4 back in terms of cost on benefits as well as productivity. And that's because of other studies that show there's a 38% loss of productivity when you have untreated depression symptoms. And then another kind of measure that's important to employers is increased retention or employee satisfaction, because it does cost a lot every time you have turnover and you have to do new training and whatnot. And so there is 32% increased retention that other studies have showed when mental health needs are engaged. And so these are real business cases as to why employers should care about mental health. Besides all the medical reasons that we're so used to talking about, it's nice to have these in your back pocket. The other last thing I'll mention in terms of a primer with employers is many of us on this call, and if you go to the next slide, exist in the healthcare system in a certain way, meaning we are often employed by health systems or clinics, and we will bill and whatnot for mental health services or any services that we're providing. But in terms of mental health, it's actually important to know that we're just a component of an employer's overall strategy. So there is the health plan that most of us exist in, right? However, there's also an employee assistance program that's specific to behavioral health that exists outside of the health plan that employees can call. And I mean, many of us are employed by a hospital system or otherwise, so we might have access to these EAP programs already, and they're just not coordinated, right? There's also third-party point solutions. So we're talking about these startup companies that provide mental health services outside, again, of the health plan. And then finally, there's other workplace programs or the workplace wellness programs, support groups or whatnot, that are designed to support the mental health of employees and their families. And so knowing that when we're talking about behavioral health integration, we're actually typically only talking about this health plan side. But from the employer perspective, there's a lot of things going on in terms of mental health that we should at least know is out there. And maybe one day, if we get really good at it, think about how to integrate that as well. So that's my primer on the employer landscape for my fellow clinician peers. And so if you go to the next slide, what I'll really lean into now is how employers are really thinking about holistic healthcare, and that's really in investing in primary care, and specifically in advanced primary care. Now, why are we doing that? If you go to the next slide, the reason why we're investing in advanced primary care is because we know it works. And so this is a picture of me prior to my time at PBGH when I was working on behalf of an employer in Central California that mostly has agricultural products. And we were providing advanced primary care to their agricultural workforce that often suffers from health disparities. But we found that when you really address holistic care, you can make a real big difference. And we have some publications here that show that, of reducing the population level of prediabetes by 50%, controlling diabetes, and also a lot of other benefits that drive towards the quintuple aim. And so if you go to the next slide, we kind of go over, besides the healthier populations, there's also the patient appreciation in terms of employee satisfaction and family satisfaction, improved health equity, happier providers. I'm here, trying to evangelize whole person care, because it really does help when you have a team-based environment to be able to support the clinician, and overall lower total cost of care, because you're removing a lot of waste in the system when you're able to address things in primary care and as a whole person, instead of kind of moving patients around all the time to try to get care in a disparate fashion. And so what we really did in our definition of advanced primary care, and by ours I mean the employers and how they came up with it, is one that really includes by default integrated behavioral health, as well as other services like health coaches, like physical wellness, a model that also looks at social determinants of health and also has a lot of services under in one spot that's easy to access for patients, so they don't have to go on this scavenger hunt after every single visit. And instead, all of that is taken care of, including the referral and scheduling referral appointments when it's needed for specialists. And so that way, the onus is not always on the patient themselves, but actually on the healthcare system to help guide them through a system that, I mean, to be honest, even those of us that are like working in healthcare get confused about all the time. Like, just imagine what the average patient feels like. And so what we decided to do as part of our definition of advanced primary care is make this as easy as possible, as holistic as possible, and team-based as possible, just to take that burden off the patients. Now, if you go to the next slide, this will kind of go over a little bit of the work that PBGH has done over the past few years. What we did and what PBGH really does is we bring together employers and purchasers to try and reach consensus and drive towards a common goal. And in this case, the common goal is holistic care through advanced primary care. And so this term advanced primary care is thrown around a lot in the market, and what we did instead was we brought together the employers to come up with a shared definition of what that actually means. And through that shared definition is where we say, hey, integrated behavioral health is table stakes in that, because everybody who's treated patients in chronic disease knows that behavioral health is a huge part of that. When we think about diabetes even specifically, we know as clinicians that lack of sleep, stress, are all going to raise blood sugars. It's going to hinder your ability to really have good diabetes outcomes. And that's the same with other diseases as well. And so how do we just integrate it in to really just treat what you're actually trying to achieve, which is better health outcomes overall? And so, so that's part of our definition of advanced primary care. Now, having created that definition, published about that definition, then we needed a way to identify it in the market. And so what we created is, and if you go to the next slide, is the PBGH Care Excellence Award. And so what we're doing is we are actually going into markets and identifying practices that meet this criteria of advanced primary care with integrated behavioral health, with informed referrals, and identifying them through awards on behalf of employers so that they can find a way to really have a relationship with those clinics. Now, that relationship can mean different things. For employers, they can directly contract with clinics. And so that means they could, instead of going through a health plan, they could actually just set up a business relationship with a clinic and pay the clinic directly to be able to provide these services. And sometimes that is the path of least resistance, because as we know, and I think what the collaborative probably already knows, is there are barriers to trying to implement something new within an existing system. And so sometimes direct contracting kind of allows you to say, hey, we want integrated behavioral health. How much is it going to cost? We'll pay you for it. And just kind of just eliminate that navigation within an existing system that wasn't set up for that. And so that's one way to do it. And then obviously the health plans still exist. And so employers will still contract with health plans to pay bills and whatnot, and provide networks. And so that also still exists within the system. Now, for those that are going more through the health plan, what we also do, and if you go to the next slide, is we work on behalf of employer priorities to work with health plans and physician practices to see how we can implement things like behavioral health integration on the ground, and what do we learn from that purchasers can then take to implement in their benefits packages. And so I invite everyone to kind of look at this publication. This is one of our publications from the California Quality Collaborative that works with practices more directly, and they interviewed physicians and plans to see what were the barriers to integrate behavioral health in California. And there are action steps for different stakeholders. I'll call out the ones for physicians, which I'll repeat later as well, which is it is actually important to bill for integrated behavioral health when doing it. And the reason is because without that billing and without the data collection, it's really hard for employers then to have appropriate advocacy to be able to try to champion integrated behavioral health either with their health plans or with their own internal leadership without any sort of information about it. And so billing, doing the PHQ-9s and whatnot are actually really important way that physicians in their day-to-day practice can be supporting employers that do want to champion integrated behavioral health on behalf of their employees and their families. There's 14 other recommendations and action steps. So I invite everyone to kind of read them. I won't go through them all. In terms of, and so with that, I'm going to start summarizing. And I actually have 3 different ways I'm going to summarize for folks. The first is, if you go to the next slide, what are the general benefits of the value add to employers that you can talk about when you want to talk to employers about integrated behavioral health and why they should care? Besides the business case that I already laid out before, this is the right thing to do. And actually, this is a way that you can lean in with employers because they want the best for their employees. Frankly, when you're talking to an employer, you're talking to one of the employees. And so they want the best for themselves too. And so they'll all have a personal experience about this as well in terms of wanting to be sure that their own family and their employees gets access to behavioral health. And that's a big deal given the crisis and the lack of access. That's why employers have moved a little bit to these third-party solutions. So it'd be great if we can kind of bring that back as a core part of our own work. It's patient-centered and it reduces barriers. And so we know mental health is a priority because of all the reasons and measures the ROI, the employee retention, the loss of productivity, but we need to be sure people are getting the care they need. And a lot of times stigma and barriers still exist. And so doing it in an integrated fashion will help employers make sure that their employees are getting the care they need. In doing so, they unlock that whole ROI value that we talked about to begin with. And it also just overall helps with making sure that all care is coordinated and continuous so that patients are really getting the best experience and don't have to go through this scavenger hunt and try to coordinate everything on their own. And so this is the real value add to employers. Now, if you go to the next slide, these are things that I talk about with employers when I'm trying to get them initially to think about integrated behavioral health after kind of getting them on board to the mission of it. And so this might also help if any clinicians are talking to employers, which is one, I think a lot of employers might not even understand if their employees and families have access to behavioral health integration. I think the assumption is that they do sometimes because we know it's the right and better way to do things. And so it doesn't always cross their mind that the ideal state isn't actually what employees have access to. And so one of the first things I will do is have them really talk to their health plans or their partners about, is this happening? And again, this is where the coding can be really, really helpful to know if that even exists in the plan. Um, and then once they know it, then put it as part of their benefits roadmap in terms of making sure that it gets paid for by the health plans and making sure that it's the cost sharing or whatever other structural things with the benefits enables integrated behavioral health. There's lots of different ways that employers can do this. One is to develop the networks where behavioral health integration is available, or have health plans collect the data or show in their contracts that they are working towards behavioral health integration. We have two of our members, CalPERS and Covered California, that actually have it written in their contract with health plans to demonstrate how they are ensuring or moving towards behavioral health integration. So that is one lever that that employers can take. The other thing that I sometimes talk about as well is, at least in California, I don't know how it is in all parts of the country, but in California, we're very heavy on behavioral or mental health carve outs. And so that can sometimes be a hindrance to behavioral health integration. And so just kind of thinking through that and realize if it's happening or not, and if that's part of the overall health benefit goals, right? And then finally, really just tracking quality measures in terms of behavioral health to really know what the current state is and being sure that there is an eye on depression screening and whatnot that can lead to and enable behavioral health integration. So these are some general kind of first steps of what employers can do that other clinicians, when talking to employers, can kind of lean into and steal. That's fine. It says copyright, but you could use it. And then if you go to the final slide, this one's really talking about, from a physician's perspective, if you're really trying to lean into this space of working with employers, here's just a reminder, a reiteration of some of the things we went over from before. One, there's a spectrum of understanding or even misunderstanding of what integrated behavioral health means or what's actually available. And so there's a big education component across all employers. You're going to get infinite amounts of understanding and viewpoints and opinions. And so really understanding where you're starting from each employer is really important. The other thing is, as I mentioned, what we do as mental health, as the day-to-day clinicians, the majority of us, we're actually just a part of the complete behavioral health landscape for employers. And so realize that. And if you're really driving towards integration, think about how to bring in those other things. The other thing to do, as I've mentioned, is in order to really advocate for integrated behavioral health, we need the data. And so be sure you're doing the screening, be sure you're billing when you can, because that provides a framework for future work. And then finally, we all talk in different languages. Clinicians will talk in different languages than employers. So be ready to shift into another vocabulary book to be able to advocate for this when working with employers. So overall, that's my primer on how to work with employers for behavioral health integration, and also a little bit about what employers are doing to achieve whole person care through advanced primary care towards the goal of behavioral health integration. I'd be happy in the future if any other clinicians or anyone watching this webinar wants to reach out. Feel free, happy to talk about it, happy to support efforts, and also happy to collaborate in terms of trying to move forward advanced primary care towards whole person care.
Thank you, Dr. Tsai, for your time and expertise today. If you have any follow-up questions to today's content, please send your inquiries to either directly to Dr. Tsai using the contact information shown here or to the AMA team at practice.sustainability@ama-assn.org. If you enjoyed today's webinar, check out the Collaborative's podcasts, including additional tips on implementation and sustainability. For a full listing of the BHI Collaborative's previous recordings, please follow the QR code at the top right of the slide to our YouTube playlist. Please also check out the Collaborative's BHI Compendium for a helpful framework on how you can make BHI effective in your practice, along with other actionable resources and practice case studies. You can also access the AMA's strategic practice guides for implementing specific topics associated with effective behavioral health integration, including care for substance use disorder and suicide prevention. Our next webinar in the BHI series will be on June 26th, focused on digital solutions for enhancing behavioral health care. We also invite you to join us next week for the next installment of our value-based care series on April 8th, focused on underlying payment methods. Scan this QR code or click the link of your resource widget to register for the entire series all at once. Finally, if you're looking for something more interactive, we would like to invite you all to attend and join us for our next Saving Time Practice Innovations Bootcamp, which will be on September 17th and 18th in person at AMA headquarters in Chicago. This 2-day in-person bootcamp is specifically designed for clinical and operational change agents looking to eliminate unnecessary work and free up more time to focus on what matters most, patient care. Through breakout sessions, interactive activities, thought sharing, tactical strategy breakdowns, and how-to examples, this bootcamp will equip attendees with the time-saving tools and strategies needed to reform their organizations and enhance professional satisfaction. If you have interest in attending, scan the code on the right now. As a reminder, today's slide deck is available for you to download in the resource widget on your console. For additional resources and guidance to support your physicians and staff, including those on effective implementation of BHI, please visit the American Medical Association website or stepsforward.org. You can register now for our next webinar from the AMA Steps Forward Innovation Academy by following the link on your console. Thank you again for joining us. We hope to see you again soon.